Welcome to the Perry Health Pulse podcast. We bring in healthcare professionals each week to discuss topics relating to healthcare, hospitals, rural communities, topics that most people don't think about or at least don't have the answers to. Remember that you can access all of the Perry Health Pulse features by going to our website. It's at www.perrymemorial.org/pulse. Did you know that 1 out of every 5 people suffers from mental illness? And we're not talking about dementia or Alzheimer's, schizophrenia. We're talking about much more common mental illnesses. Today we're joined by 2 guests. We've got Angie Hughes, who's a licensed clinical professional counselor, and she's the program director of Perry's Senior Behavioral Wellness Program. And we're also joined by Ariel Posey, who's a licensed clinical social worker with our family health clinic. And today, Angie and Ariel will be speaking about what they know about mental illnesses from years of working with patients, what some of the signs and symptoms of those illnesses are, how to address it if you notice or suspect somebody has it, including yourself, and what are some of the most common mental illnesses are. And we're going to start out with that. What are some of the most common mental illnesses that people would suffer from?
Well, the top 3 would be probably just overall would be anxiety disorders, major depressive disorder, and then we also have substance use disorders. Oftentimes, anxiety and depression can co-occur, so some of those symptoms will mimic or they will look like each other.
I agree with that. You've got your mood disorders and then you've got your anxiety disorders, and sometimes it is difficult to differentiate between the 2 of those.
You know, with substance use disorders, oftentimes those co-occur again with your mood disorders or your anxiety disorders, and people use that to self-medicate. Because people with a mood or anxiety disorder are 2 to 3 times more likely to have a substance use disorder.
Within these categories, what are some of the types of mental disorders we've heard of, and maybe some that we haven't heard of as much before?
Some of the more common ones that you've probably heard of would be generalized anxiety disorder, maybe a social anxiety disorder. Phobias, those fall into anxiety disorders as well. On the mood disorder frame, there's major depressive disorder, there's bipolar disorder. Those are 2 of the biggest ones, I would say.
Are some of them more treatable than others?
They all can be treatable, yes.
And I think the piece to really look at more so is that with mental disorders, they can have a major impact on a person's life that causes them more disability than most people realize. So that disability kind of refers to how it might affect their impact on their work, their family, and even their social life. And sometimes you might hear people talk about the 4 L's, how it might affect somebody's ability to live, learn, laugh, and also love. And sometimes people throw in a 5th one called law. As far as the treatment, sometimes you'll hear people talk about recovery. And recovery is actually a process where people are able to learn to be able to live, work, and participate in life and within their communities. And that's going to look totally different for each person, because for some it's going to imply a reduction in their symptoms or a complete remission of their symptoms. And for others, they're just going to learn how to cope with the illness, the crisis, or the trauma that's associated with those challenges.
Mental illnesses can also affect your physical well-being, right?
Absolutely.
Can you speak to that a little bit?
Oftentimes when individuals will go to their primary care, those are the symptoms that they will share, is their physical symptoms. So it may be they're having headaches, maybe they're having
Stomach issues.
Gastrointestinal, right, stomach, their sleep is off, maybe their body's aching more.
Feeling tired all the time. Those are very common symptoms related to mental illness.
I have the stigma about mental illness that somebody has it for life. That if you have a mental illness, you've got it. It might start at some point, but that you have that for the rest of your life. Is that true?
You can experience different episodes with recurring symptoms throughout your lifetime, but not necessarily in a constant state. So you might have some symptoms related to depression when you're 18, and then things kind of taper down and you're feeling better, feeling more confident, and then something happens in your life later on and those symptoms flare up. So there's not an easy answer for this. It really just depends on the individual.
And it's probably not that exact of a science either.
No, and remember that with mental illness, it can be on a continuum. So we can have symptoms that if we learn how to cope with healthy coping mechanisms, we're able to manage it much better than if we're, as Ariel said, we're in an episode where we're having severe symptoms.
So what are some of the signs and symptoms you might, for the everyday person who has family members or friends, that they could maybe pick up on a little bit of some of those signs and symptoms that indicate mental illness might be beginning or might be happening in that person?
So we kind of touched on some of the physical symptoms related to anxiety and major depressive disorder. Other things could be crying spells, maybe family members isolating, not wanting to socialize, just overwhelming sadness. You might notice your family members feeling hopeless or worthless even. Thoughts of suicide are also another thing. Self-injury can be another warning sign. So being aware of those little changes in behaviors and how you're interacting with your family member and how your family member or friend might be interacting with you.
And some people with anxiety, sometimes they may just have this restless feeling. They may actually even have where they feel like they're having racing thoughts where their mind just won't rest, even especially when they lay down and sleep at night. It's just like everything just keeps going through their mind. Just a lot of excessive worry and maybe even fear that happens.
If you were to suspect somebody in your family or a friend, somebody has a mental disorder, what should be the approach to that? Because I could see thinking that and then, talking to them about it might push them away or make them less likely to seek out help. So what would you suggest as an approach to doing this?
First, I think we need to make sure that we're assessing for any risk of suicide or harm. And we may have to actually ask those hard questions with somebody, are you having thoughts of suicide? Are you thinking of killing yourself? And these can be really hard questions for us to ask. And if the answer comes back yes, then we need to either reach out to the suicide hotline with them. We may need to go to the ER or we may need to call 911. And it's important that we don't leave them alone. If we can rule out that they're not a risk to self or others, then I think it's important for us to listen non-judgmentally. So our attitude and our nonverbal skills can show a lot if we're actually actively listening to them. And it's important for us to realize not to throw our opinions or attitudes onto the individual, that to listen. And we may ask them, how long have you been feeling this way?
The biggest point that I want to drive home is that you let your loved ones know that you're there for them, that you're listening, that you're here to help in a completely non-judging way, like Angie said. Oftentimes when someone's struggling with some sort of mental illness, they do feel alone. And they do feel like there's no one there that understands or wants to help them. And that's just so important to help them understand that they do have support and that people do care.
Mm-hmm. So treating them with that dignity and respect. Because sometimes the window of opportunity for somebody to seek help can be so slim. And it can take sometimes up to 10 years for somebody to seek help. So when they're usually coming to us,
the symptoms have already been going on for such a long time. They're so embedded in those negative thoughts. It's very difficult to make those positive changes for yourself or your loved ones. But the more the person perseveres and pushes through those uncomfortable feelings, the better the outcome.
Well, because people who have mental disorders, mental illnesses, they don't expect to have them. There's nothing that they know of that's causing it. It just...
Right. It's like diabetes or heart condition, And a person can experience trauma in their life that can affect them throughout their lifetime. There can be genetic components, there can be a chemical imbalance. So it's no different than a person having cancer or a heart condition. But there is still that stigma, and that's the hope that we continue to reduce that with people having a better understanding.
It kind of sounds like for the most part it's up to the person to decide to seek out help, unless it's a dangerous suicidal situation, so if you suspect somebody, try to find out if it's a suicidal situation, and if it's not, listen to them and encourage them, and then hope that they seek out that help. Can you tell me a little bit about, once a person does seek out help for mental illness, what happens? What's the process?
So a person will come in and they'll tell me all about themselves, their social history, their family life, pretty much any aspect about themselves that they feel comfortable sharing, for me to help determine the best course of treatment. So here in the hospital, I do solution-focused treatment. It's generally 3 to 5 sessions, but it depends on each individual patient.
And within senior behavioral wellness, we will get a referral. It could be from the individual themselves. It could be from their primary care physician. It could be a family member. Then we set up a screening, and once again, just like Ariel, I do probably about an hour-long screening that asks all kinds of questions about what's happening now, what's happened in the past. We do some assessment tools also to check to see for cognitive ability to be able to participate in our groups cognitively and physically. We also do depression screening and a Hamilton anxiety scale. And then once they see our program director, who is a psychiatrist, Dr. Scott Arbaugh, he oversees our program, then we determine what their treatment planning is going to be again. It's all individualized treatment. Our major modality of treatment, though, is group counseling. And I know when I say that, most people are, all of a sudden, the wall goes up. I can't talk with people. There are so many benefits to group counseling. People recognize they're not the only one that's experiencing these kinds of situations. And like we talked earlier, with mood disorders, and it can even be with anxiety disorders, you have a tendency to withdraw. So you have that extra support within the group members. They validate each other. They learn together through the process, and we learn coping skills. We have lots of educational components to the programming. We also do individual sessions too, so it's all individualized.
Can I have you, for any listeners who might be interested in finding out more or need to get in touch with somebody, can I have you share contact information or any resources that you'd want them to know about?
If you're interested in scheduling for some individual counseling here at Perry Memorial, you can contact me, Ariel, at 815-876-2344. There's also a crisis text line that I like to tell a lot of my patients about. People don't feel comfortable calling in to suicide hotlines often, so this crisis text line is a free resource as long as you have texting availability. You can text the word home, hello, I need help, I need someone to talk to the number 741-741. And there's a live volunteer person on the other end ready to sit and talk you through that crisis.
If anybody is interested in participating in the Senior Behavioral Wellness Program, like I said earlier, we are a Medicare-based program. You can contact me here, Angie Hughes, at Senior Behavioral Wellness, and our number is 815-876-2004. And also be looking in the near future for opportunities to participate in mental health first aid. Mental health first aid is an 8-hour certification course, and what it does is it helps offer a person that's developing a mental health problem or experiencing a mental health crisis. The first aid is given until appropriate treatment and support are received or until the crisis resolves. So it helps individuals, give them some tools so that they could help an individual until they were able to get the appropriate professional help.
So for people who want to know how to respond and handle mental illnesses, but who aren't really, they're not the end person to deal with it, but in the moment they can be there and help with it.
It gives them the tools. It doesn't give them the tools to be to diagnose or to be a therapist, but it gives them those tools where they could help.
Well, with that information, hopefully it helps people be more aware about how they're coming across to family and friends who might be suffering from a mental illness without you even knowing it. And most importantly, be aware of what resources are available, what avenues are available to seek out help so that it doesn't continue to progress. Remember, all the resources for this episode that were mentioned, information about the guests is available on the website, www.perrymemorial.org/pulse. Thanks for tuning in.